Bernie Sanders is introducing his Medicare-for-all bill.
I intend to co-sponsor the Medicaid-for-all bill.
Under the guise of Medicare for all.
That's what Medicare for all is all about.
Medicare for all is actually much cheaper than the current system.
That guarantees health care to all people in a cost-effective way, which is what Medicare for all is.
Transitioning U.S. healthcare from a private insurance system to Medicare for all or a single-payer system would be a massive endeavor. After all, healthcare accounts for 1/6 of the U.S. economy. And right now, people get their plans from all over the place.
It might be paid for by your employer, you might buy your own insurance plan, you might be on Medicare, you might be on Medicaid. Single payer means that there's one payer, the U.S. government, and it would pay for everyone's healthcare bills.
That's not cheap, and taxpayers are likely to foot the bill. So just how much would this all cost? Well, that depends on who you ask.
Let's just say hypothetically,
okay,
you are self-employed, and you've got a husband and 2 kids. Okay, family of 4. Do you know how much that family is paying today for health care?
How many?
$28,000 a year.
Okay.
But that $28,000 isn't as straightforward as Sanders makes it seem. It comes from the Milliman Medical Index, but that index is used for people who get insurance through an employer, not those who are self-employed. The Sanders campaign said he misspoke, but he's previously tweeted the same factoid without the self-employed qualifier. Regardless, Sanders' language is misleading. According to the index, almost $16,000 of that $28,000 is already covered by employers. So the visible cost to the ordinary employed 4-person family is a little over $12,000.
Are people going to pay more in taxes? Yes. But at the end of the day, the overwhelming majority of people are going to end up paying less for health care because they're not paying premiums, co-payments, and deductibles.
In order for this family of 4 to feel like they're saving money under a Medicare for all system, their taxes would need to increase by less than about $12,000 per year. And that tax increase depends on a wide variety of factors. Think of this like an equation. As each of these numbers goes up or down, the overall cost to taxpayers changes along with it.
One, of course, is how much you pay doctors and hospitals. If the government pays them less than they're getting now under commercial plans, then yes, you could achieve more savings. However, a lot of people have argued that it's not feasible to suddenly reduce payments for doctors and hospitals to Medicare rates.
Doctors and hospitals could argue they can't provide adequate care because they would no longer have the funds to cover their costs. But say, for example, hospitals were paid at current costs, and only doctors reduced their rates to Medicare levels. With that assumption, one study found healthcare costs would rise, and national healthcare spending would be higher than the current system. Senator Sanders' plan includes coverage for a loosely defined set of services related to long-term care, but they're careful to exclude nursing homes, saying Medicaid could still pay those costs.
If you add in long-term care services, people are saying that would add significantly to the cost of the legislation and make it a lot harder to fund. And there's also the question of cost sharing. You know, employees are generally required to contribute a monthly premium. They often will face a deductible as much as $5,000, $10,000. Under Sanders' plan, he would eliminate all of this. People would be able to visit the doctor without any extra cost.
Analysts warn that could lead to rampant overuse of the healthcare system.
Medicare for all advocates frequently cite a figure for the administrative costs for Medicare and say, you know, that's significantly less than what private insurance now pays. But that's up to dispute. And there are other experts that say that actually the administrative cost estimates for Medicare are actually higher. So if they're wrong about that and they're not able to get those efficiencies, healthcare is going to cost more.
The Sanders campaign pointed to 2 studies, one done by the University of Massachusetts and one by the Rand Corporation, which show middle-class families would save under a Medicare for all system. But both studies make generous assumptions about the government's ability to negotiate lower payments to providers and to slim administrative costs. The thing is, each one of these factors has dramatic implications for the tax burden of any Medicare for All plan. And so without reliable estimates or consensus among experts, Sanders' assurance that the average family of four would save somewhere between $12,000 and $28,000 is misleading at best. It only comes to fruition under the best possible circumstances.
Two of the biggest healthcare programs that have been enacted in the past were Medicare and Medicaid. And years later, people discovered there were unintended consequences. What single payer is proposing to do, or Medicare for All, is a much bigger scale than, say, for instance, Obamacare, the Affordable Care Act, which was mostly focused on the individual market.
The only certainty when you're making big changes to the healthcare system is that it won't go as planned. And so when a politician tells you that you're going to save money under a given plan, don't count on it. Sanders is trying to paint his plan in the best possible light, and so he's using assumptions that will do that. In other words, it could end up being a lot more expensive than he's saying.
You're not paying any more co-payments. You're not paying any more deductibles. How's that? $28,000 you're not paying. But does that mean you're not going to pay something? Of course it does. You're going to pay more in taxes.